Welcome to Reducing Risk, a series of podcasts for medical protection created specifically for clinicians in Aotearoa, New Zealand. Reducing Risk looks at key medical legal issues in our jurisdiction and provides helpful advice and guidance on how to manage those risks. Today we're covering the first of two podcasts on toxic workplaces. So why are MPS interested in this topic? We aren't employment lawyers and we aren't a union. Our job is medical legal defence, so we normally only get involved when there's been a complaint or an adverse outcome involving a patient. So why are we interested in talking about the difficulties we have with workplace interactions? Today I've got with me three of our colleagues. My name's Dr. Lucy Givard. I'm one of the medical legal consultants at Medical Protection, and I'm also a GP in Taranaki. And today I've got with me Sam King, one of the other medical legal consultants and also a GP. Hello, Sam.
Hi, Lucy.
And Chaoyan Chen, she's an anaesthetist from Auckland, and she's also a medical legal consultant. Hi, Chaoyan.
Hello, Lucy.
And also Sean O'Sullivan, one of the partners at Wood & Kearney, who is an employment lawyer. Thankfully, we've got some expertise on the ground there. So hi, Sean.
Afternoon, Lucy.
So look, I think we'll agree that most of our cases, poor interactions between colleagues and other healthcare professionals do actually sometimes adversely affect patient care. And it's not uncommon for a breakdown in collegial relationships to actually end up with one party reporting the other to the medical council for unprofessional behaviour or accusing the other of incompetence. And that generally tends to be when MPS gets involved. So looking at workplace interactions can actually help us reflect on what's happening in our department or clinic or practice. And hopefully we can reduce our risk by improving communication, understanding and mutual respect.
Yes, I can actually think about a number of cases where a breakdown in collegial relationships has ended with a notification to the medical council. I'm not sure that the medical council are at all keen on getting involved in interpersonal battles, but council being as they are, they take a very conservative approach. So if there are any concerns about competence, they are duty-bound to look into it. That said, I have had the occasional case where council has seen things for what they are and haven't pursued it too far, but generally they do have to investigate.
Yeah, and look, it's a place we'd all rather not go, really, isn't it? So, Sean, what does the medical council actually say about how we should interact with our colleagues and with each other?
Lucy, they have a statement which is very clear. Unfortunately, with all definitions, everything always depends on the circumstance of the case. There's no standard case where this arises, so you have to look at the facts. And definitions and statements are only good as far as they're illustrative of what is generally in place. What I would say is that the Medical Council are very hot on collegiality and collaborative behaviour, and it's become a focus for them. So this is a really important topic from my experience. But if this helps, I think what the statement sort of expresses is these conduct as being within the range of bullying. So behaviour such as intimidation, harassment is obviously in discrimination, clearly racism, insensitivity and rudeness. When you put your own interests ahead of others, or in a environment, violent, abusive, threatening, or offensive behaviour, aggressive, demanding, and overly critical comments in a public sort of setting, refusal to work collaboratively with others and follow best practice, inappropriate communications, and that's also including social media, both within a work scenario and outside of it. So it's very wide and all-encompassing, and as I say, it depends on each individual situation. It's a bit like when you see it, you know it, but it's very difficult to explain in advance.
Yeah, and it can be just a one-off incident, or actually more often it tends to be a pattern of behaviour where the medical council are more interested. But one particularly bad incident, I think, can actually lead a doctor to be complained about to the medical council. That social media thing, I think you and I have had a case together with that, Sean, haven't we?
Yes.
It does tend to have a bit of a sting in the tail, that one, doesn't it? We seem to have a few doctors reported where things have been said on social media platforms, and that's being considered unprofessional.
It's very dangerous, social media, because once it's out there, it's unlimited in terms of how far it can go. So social media is not really a place for criticisms. I think social media should be kept for positive, constructive things. If you're ever going to criticise or make a negative comment, I would simply say never ever do it on social media.
Yeah.
It's interesting, a lot of doctors belong to closed Facebook groups or WhatsApp groups, etc., and some of them can be very big. I'm thinking about the New Zealand Women in Medicine or the GP for GP page, and I'm sure you probably belong to a few too, Cha-Yen.
Yeah.
And it's easy to consider, this is a private forum, therefore it's safe, but actually anybody can take a screenshot
Absolutely.
and send that around. And
they do.
And they do.
Yes.
And the other thing I've noticed is that from the safety of your own home, people say things about other people that they wouldn't necessarily say face to face. And I think before we say anything negative, as you say, we need to think carefully, is this the right thing to do? Would this be considered unprofessional behaviour?
It's a really good point, Sam. Both the courts, but the Medical Council also have followed, say, if you put something on social media, you're responsible for where it goes, irrespective of whether you intended to go there, because it's such a powerful beast that you have to just take responsibility for it. So you're not going to ever have an excuse of, well, I only sent it to one or two people. Once it's out there, and it's your responsibility.
Well, that's a really unattainable requirement, right? You're responsible for how far it goes.
Well, yes, it is. Although what I think the courts and the Medical Council will be saying is, if you put something on social media, knowing in the knowledge that you can't control where it's going to go, then the blame falls on you if it does go outside of where you intended it to go.
Right. So, and then it just needs to upset one person, and they can complain to Medical Council.
Yeah. Again, this is my problem with hypotheticals in advance. It depends how serious that was, but the answer is potentially yes.
I've had a case reasonably recently where that happened. There was something written on social media and there was one person complained to the Medical Council. Yeah.
Yeah.
So yes, it is a high risk and something we don't really think about very much, is it? As far as dealing with colleagues,
Yeah, you've had a rough day and you just sit down, you want to vent some steam. So you type on Facebook. Stop.
The other thing I find, I suppose, is that the written word comes across differently than the spoken word.
Absolutely.
So when you put something in writing, you might think it's said in jest, or it might even be a joke, or it might be funny, but when people see it and when it's spread around, it comes across completely different. That's the other problem with social media and the written word or emails that include other people in it. So yeah, it's very powerful when you see it. So yeah, I just counted. I just say keep negative comments to a safer forum than social media or even text for that matter.
Oh, well, I've definitely had arguments with my partner thinking that he was being brusque or short with me on text. I didn't mean it that way.
A great example.
Yeah.
I've also had a case where a member had written an anonymous blog. So she didn't put her name to it and she thought there were no identifiers, but actually she was identified and that had implications for her. So I think, in any form, New Zealand is such a small place and you just don't know who's going to see what and when. And so it's easy to be identifiable.
I think what we're saying, isn't it? Bullying is very easy to do over the internet, because of the range of people it can get to. So, it's a real worry now for...
So look, we've had a look at what the Medical Council statement says under their section of conduct and professionalism. But actually, the next one that we probably need to have a look at for statements is what to do when you have concerns about another doctor, where the Medical Council have outlined this tiered approach on what we do, or what we should do if we're raising concerns. And they suggest that in most cases, if you've got a concern about a colleague or another doctor, the best thing to do is actually to raise that with the doctor themselves. And that is generally the advice that we give when we're rung about these kind of issues. And then if you haven't managed to solve it with the person themselves, obviously raising it within the organisation you're working in and really only taking it to the Medical Council if actually you feel like that's your only option. Or if there's no one to raise it with internally. And clearly, if there was a risk of patient harm, we'd expect you to do that faster. But in general, we it's better if things aren't escalated to the medical council. And I have to say, I've had a case where the person who made the complaint ended up being criticised because, in fact, it was an issue between two people who were in conflict, and in fact, neither of them were probably behaving that well. And so, we'd probably advise our members to try, if possible, to keep things away from the medical council.
I think, though, it's hard often for any of us to know where to start when you've got some kind of tension in the relationship, to know what to do. And so it's always good, I think, to get advice early, because once you've made a bit of a mess of things, sometimes it can be hard to go back and tidy it up afterwards. So I would get advice early around that, if at all possible. And we do get calls on our advice line asking us how to manage certain things, and we can do that. And people also, if it's a strictly employment matter, often we'll ask someone like Sean or one of his colleagues to speak to them on the phone around the employment implications and how to manage things from that perspective well. You must get a lot of calls around that, Sean.
We do. And in a perfect world, I think, going back to Lucy's point, having the direct informal conversation with the person you're concerned about first is always the best. But that is a perfect world comment, and it's often difficult to do that, and often that can be misinterpreted, and you can sometimes be complain about that. So I think the answer is to strike early and to raise the concern early, either with the person concerned, if you feel comfortable doing that in an informal setting, not in a meeting in front of everybody else. Or secondly, to raise it with the direct supervisor, someone internally, and get them to do it at an early stage. That would be my advice for sort of the stitch and time saves 9 kind of approach to any problem like that.
And I suppose we actually ought to think about ASMS as well for specialist colleagues, that actually sometimes ASMS may be the right people to call as well. So taking a step back even further about how we actually communicate in our workplaces. And so, it's useful to think about how we can actually stop these things blowing up in the first place. And I think what I'd like to do is just have a look at a fictional case that we've drawn up, and maybe we could use it as an example to talk around. So in this fictional case, we have a hospital doctor called Charlotte White who's called MPS about a workplace issue. Dr. Barry was employed by the department, and at the start of his employment, things were going well. But over time, Barry seemed to become more isolated and didn't take feedback well. Tensions rose, and Charlotte and some other colleagues met with Barry informally to talk about some of his clinical decision-making. Barry reacted in a very confrontational way and stormed out of that meeting. So what do you think, Cho-Yen, how do you think, what caused him to feel that way? How did that go wrong so early when they were just trying to raise clinical issues?
Yeah, I think even with the best intentions, when it's a meeting like that, he might have felt a bit ganged up on and felt a bit victimised, especially if you're presenting it as, there's more of us than there is of you, and we think that you've done X wrong. So he might not have been able to hear the rest of the explanations, because the first thing he thought was, well, you don't think I'm a good doctor.
Yeah. I'm feeling bullied.
Yeah, that's right. So I don't know, maybe it would have been more helpful for Charlotte to try and talk to him alone initially.
Yeah, I guess it depends on how safe Charlotte would have felt in that situation. But you wonder whether they could have offered him a support person.
That's right, yeah.
Yeah, and actually given him maybe a heads up that we're going to talk to you about this. Who are you happy for so-and-so and so-and-so to be there for us to talk? Who would you like to be there? Actually, do some signposting of what's coming, so he doesn't come into a meeting and feel like he's being ambushed by it. Yeah, so maybe that would have been a good start. But sometimes I think a one-on-one conversation is actually the best way to start, but it can be, some people find that very, very challenging when they're actually having to hold a colleague to account. It can be a really tricky thing to do. So people often would think, oh, we'll do it as a group, but actually for the individual who's actually been talked to, often that feels worse, really, doesn't it?
It does, and it's also a team dynamic issue because in the circumstances you're raising, he had become more isolated prior to this, and so it's sort of a cause and effect, isn't it? Because he was isolated, then he felt ganged up on, and so I suppose it's about trying to get that team dynamic working and being supportive early on and having that relationship early on, and one-on-one meetings early on are I suppose the best way to do that, and so he doesn't feel isolated.
Yes, Sam, can you think about other factors that maybe would make interactions difficult, not necessarily from this case, but just in general that sometimes make it difficult when we're working with colleagues?
Yeah, I think probably one of the big things is our manner. Most of us probably when we're stressed or busy can come across as being a bit brusque or rude or angry, even when they don't mean to be, but that's often how we do present ourselves. If there have been past difficulties in a relationship, when you have something else come up, that can often colour how you respond or how you even think about the other person and the situation. I think what can be very difficult, particularly in a hospital system where it's very hierarchical, is, if you're dealing with a more senior colleague, I think it becomes very difficult, whether it be, junior doctor versus an SMO, or even with a junior consultant versus a senior consultant. I'm sure you probably see that, Chow-Yin, in your job in the hospitals.
Yeah, that's right. There's always that hierarchy, and it exists in every department, at every level, even within managers, between managers. It's just there all the time. So
makes it very difficult, whereas in primary care it's a much flatter structure, so it makes it a little easier. But, if you've got difference of opinion on how you manage patients, that can create a lot of tension. Confusion around guidelines, policies, a lack of support or supervision. So if, the team's been left to do their own thing, you can find that things wander off and then disagreements arise. And, just even personal things, like if you've got personal issues going on in your world, you've got a sick relative or, or something along those lines, those things have an impact and you can't help but perhaps approach your job in it just becomes harder if you're upset going to work.
And look, we often don't necessarily know what's going on in other people's lives. We work with people every day, but, some people are very open about what's going on in their lives, but some people aren't. And so we may not know what's happening for them in their relationships outside work or with their families. And we can often be a lot more tolerant and understanding if we did know those things. So actually, I think that's kind of one of the protective things, isn't it? Actually knowing your colleagues and asking them about their life and finding out a bit more about them, because we tend to be much more tolerant of people that we have those connections with. So even if that person's short with me, I might think, oh, that's all right. I know what's going on. I can cope with that. Rather than thinking, oh, look, he's just been rude and arrogant, I actually think, oh no, he's actually struggling with his social phobia at the moment. So I can understand that.
It's always easier, isn't it, if you know your colleague is normally very warm and friendly, but suddenly there's a change. It's easy for us to think, oh, there must be something going on. But for people, I guess, who you've always found difficult, it's harder for us to get to that place of thinking maybe there is something going on. But I think it is worth trying to get alongside other people, because the better we know people, the more grace we give them, I think.
Yeah, and I think we often are quite frightened about having those conversations, that actually you don't want to make things worse. You think, oh, I'm going to have to keep working with this person. Shall I just say nothing and leave it? Because actually, if I say something, it might be worse. Yeah, I might cry. That'll be bad. And we get very little training in actually how to communicate with colleagues and how to actually have those hard conversations. And the stakes are very high.
Absolutely.
So often that makes it, we avoid it then, because we just don't want to make things worse.
And the problem is that it doesn't go away and it gets worse and it gets, and whereas you had the ability, I think, to step in early and get that relationship going, even if it was a tough discussion, but it just gets worse. And now, unfortunately, it gets to a point where that kind of discussion doesn't work anymore. So, it is really a stitch in time saves nine situation.
Yeah, I had a colleague who would always be really stressed in theatre and be rushing everything. And it turned out that they had a schedule that was perhaps a little unrealistic and not communicated to the rest of us. So they wanted to get through the work really quickly and finish at X time that none of us knew about. And then they'd get more and more stressed. And then one day they came to work and said, I need to finish at X time. And we all rallied and got through and had a great day. So it makes a difference.
Simple communication. But the thing is that often these conversations can be a bit spontaneous and unplanned, which I think makes it very difficult, because often that's when we say things we perhaps later regret. And but I guess my question would be, should we be having these spontaneous conversations? What do you think, Sean?
Look, I'm going to give you a typical lawyer answer. It depends on the circumstances. Look, I think a spontaneous discussion sometimes when at the time something happens, when you see it, we have that discussion, I think it can be really valuable. I would say yes, because, you know, it's immediate. Sometimes these things can be over-rehearsed. I mean, you're asking a lawyer who will always try and over-rehearse things. Sometimes a spontaneous discussion will work very well. Again, it's you know, the situation. It depends on the person. I think we have to turn it around on the person who's receiving constructive feedback and say, you know, you've got to see it as a chance to learn. You've got to see it as a positive thing, and not always be defensive or take it as a criticism. And that and if you can turn it around a bit and start looking at the recipient, I think that's also a good way of dealing with these issues.
I think it's important, though, if you're going to do spontaneous, that you don't do it at a time when you're feeling very emotional or very angry or very upset. You know, that actually sometimes it is an issue, an acute issue that's turned up, and you're just so frustrated and upset. That is not necessarily the right time to have that spontaneous conversation. That actually maybe take a breath and, you know, give it a little bit of time to calm down, because that tends to be when it goes wrong, isn't it? When we go into those conversations emotional.
Yeah,
absolutely, and that's why
that's usually the time when you want a spontaneous conversation.
Absolutely, I suppose I was looking at more of the small things that happen as you're going along, and you should raise those at the time. And there's nothing wrong with doing that spontaneously. If it's a major issue, then obviously the 24-hour rule can obviously apply.
Yeah, write it down. Leave it a day. Yeah. So what are we going to advise Charlotte in this situation? She's got this colleague, Barry. He's getting isolated. They're worried about his work. What do you think he needs to do, Cheyenne? How would you think Charlotte should address this?
I think there's a few considerations in the situation, and sometimes it's helpful to identify whether Barry has some support within the department, someone who you could suggest perhaps in your next meeting that he talks to beforehand, or ask him early if he'd like to bring a support person, if you have that opportunity. But other things like, am I the best person to address this? Is it my job? Well, in her case, she's the head of department, so it may well be, but can she talk to other people to find out whether it is her job or if there's someone else that's better to do it? What independent resources can I use? Like, are there DHB guidelines, medical council statements like we were talking about earlier? Someone from HR who could give her some advice, or the hospital CMO who perhaps deals with these issues more frequently can give her some advice about how to manage a colleague if their clinical approach to certain matters aren't within the hospital guidelines. And then she could think, so if she was going to discuss a behaviour, it's the best approach to focus on behaviour, because that's what we can change. Otherwise it becomes a bit personal, and that's not what you want in this situation. And so can she find concrete examples of issues, and can she identify with him behaviours that he could easily change, and explain why she didn't address them with him at the time?
Yeah, I think people often feel like they've let things go, and then if you haven't addressed them at the time, you've kind of got to say, the poor Barry at the other end of it is, well, look, that happened 2 months ago. Why are you talking to me about that now? And so you have got to have a think about that, really, don't you?
Yeah, I think that addressing things early, whilst it can be a little fraught if you do it wrong, it is a good idea because it stops things from ratcheting up, escalation. And because you end up with this unhealthy culture where, often people start to grumble and you can feel really discontent in your job, and then you start saying things, and then it just loops around to the point where it can get it just goes too far where you can't pull those relationships back.
In an employment context or in a workplace context, the unknown is always the psychology or the way the recipient will receive what you're saying, and you can second guess that all you like, but you'll never absolutely know. So there is an element of you have to jump in and take that step, and the earlier you do that, normally if you do make a mistake, it's a smaller mistake than when it's later on, and you can manage it. So that's why I'm kind of on balance more in favour of an early intervention.
Yeah, and I think if you are going to raise specific issues, I think having specific examples is really useful, because people, if you just say, oh, you're not collegial, or oh, you're not interacting, people can't answer that. But if you can say, oh, in that meeting, the tone of voice you used really upset so-and-so, she was, so you can actually get a concrete example that happens, that helps, that they can then actually answer it. But you've got to be careful that when you're raising them, that you're actually not putting your own emotions on, you were rude, so much as Eleanor found that you were upsetting for her. So, trying to turn it the other way around, and trying to find out how he found that meeting, what happened from his point of view. I think when we're dealing with our colleagues, what we really do want is to find that mutual purpose. We are all there to try and help our patients and actually to get good outcomes, and no one wants to go to work and argue with their colleagues and have a miserable time. So, if you can actually say to Barry, look, we're all on the same team here, we all want the same thing, we all want the best for our patients and the best for this department, how can we achieve that together? That is a kind of more likely to get a positive response from him than actually just criticising. So actually trying to find a common purpose might be useful.
I really agree with that, because we all become a part of a department or a team because we were selected at some stage. So you didn't walk in off the street. People wanted you there. So it's useful to remember that when you hired someone, you wanted them for their qualities, and there's a reason for that. It'd be useful to bring it back.
So have you got anything else that you can think about with that, those?
Yeah, I think, you talked about focus on the behaviour. It's really easy for us to not focus just on the behaviour, but the more objective I think we can be and the less emotional we are, the better everything is going to go. And I'm not saying that it's easy to do that, because when relationships have become very strained, it's hard to keep the emotions out of it. But I think it's actually very important, and it's part of, professional behaviour that we're more objective and to remain professional in our approach.
And I do think it's really important, because often when we go into those meetings, we're thinking, I want to address this behaviour, that behaviour, I'm going to want to talk about this and talk about that. And you have all the things that you want to talk about, but you haven't really got a list of all the things you want to hear about. Do you know what I mean? So you often go through saying, I need to raise this, I need to raise that, I need to raise the other. But you haven't got a big chunk that says, I need to listen. I need to hear what he thinks and what he thinks is going to be going on. And so it's easy just to, and if it becomes too one-sided of you raising all your concerns and not listening to what his experience is, I think that's often where it goes wrong. And that actually in the meeting, listening is probably just as important as bringing up all the issues.
Absolutely.
I'd agree. I think, I've been in enough meetings with members and employers or whomever where it seems as though the employer has come with a predetermined idea
Yeah.
They say that they haven't. They say they've come with an open mind, but by the very questions that they ask, you can see that they've really made a determination ahead of time and they're just waiting to confirm it. And I think when we go into any meeting like that, then you've already lost.
Yeah. Yeah, listening is important. And the other thing I think is important is follow up, because it's all very well to sit down and talk to somebody about something, but actually you do also want them. It isn't a single point in time issue often. And actually it really helps to follow up with either an email or the meeting minutes or something so that we all know what we talked about and what we agreed, and maybe a follow-up plan of when you can have another meeting or what's going to happen moving on, so that it isn't just a single point, or if it is, at least you have some documentation that you can later go back and look at.
Sure, I think it's really important. And at the early stage, it doesn't have to be a formal document or anything. It can be a chatty email saying, "Hey, it was great catching up. Let's do it again sometime." Just and then spell out what it kind of had been agreed, and do it in a very informal and chatty way initially. As it ramps up, obviously, you need to take the more formal approach. But those early little interventions just require a simple little email. But it's very important that you do it.
I was wondering about the space for a restorative process to happen within a department or between two people. And that can be formalised, can't it, Sean?
Yes, it can, and it's the buzz word and the buzz thing to do at the moment. And I think it's very valuable. And again, the sooner you get onto that, the better. There are people more qualified to talk about restorative processes. We seem to be the more adversarial ones, I suppose. But yeah, I think it is something that should be thought about. Too often it's used at the bottom of the cliff rather than at the top of the cliff. And so I think an early discussion about a restorative process is a great idea.
And I do think when you're dealing with a difficulty with a colleague, that actually you kind of have to see where is this going to end, what's going to happen, because the chances are actually everyone's still got to keep on working together. So actually, if our goal has got to be to make the relationship better and to make our understanding of each other better, and actually it's all very well to address all those behaviours and talk about them and expect the other person to change, but actually generally there needs to be change on both sides, and actually increasing our understanding of each other is probably the best outcome we're going to get, isn't it? And
Yep.
and we're probably not going to get perfect either.
Yeah. One of the best interventions what we've had was when everyone was Myers-Briggs, and in our team, and so we all knew. And because I was the extrovert and I was in a room of introverts, so they all realised why I was annoying them all the time, and it was really good. I mean, but just understanding that how other people work is really powerful. Really powerful.
I did Myers-Briggs. I found that really useful to actually, because you tend to assume that when somebody is behaving a certain way, what their thought process behind those actions are, which would be what your thought process if you did that action. But in fact, often people just haven't got it at all the same as you. So it's very interesting to see how different people work. So look, we've talked a bit today about how to address a difficult collegial relationship, but I think we're going to take a break here. And next time we're going to talk a little bit more about bullying and harassment, and also a little bit about building a better team dynamic. And then very briefly, maybe about narcissism, because that does seem to be an issue that we often get raised with us. So that's all to look forward to next time. Thank you for listening to this podcast. I hope it's been helpful. If you like Medical Protection podcasts, please subscribe and leave a review. And if you'd like a podcast on a specific topic, please email nzpodcasts@medicalprotection.org. See you next time. Thanks, Sean. Thanks, Charian.
Thanks,
Lucy.
See you next time.